Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Causes of pelvic-ureteric junction obstruction. There are two major causes of pelvic-ureteric junction obstruction. One, we have congenital causes. Second, we have acquired causes. First, in congenital causes, there is an aperistaltic segment. This aperistaltic segment is mainly present due to the disorganization of the smooth muscles and the collagen deposition. So, between the renal pelvis and the ureter, there is one segment of the ureter where there is abnormal smooth muscles and collagen deposition. As a result, peristalsis will not pass. So at this site there is pelvic-ureteric junction obstruction is seen. Second, crossing of aberrant renal vessels can occur. Whenever there is crossing of aberrant renal vessels, these aberrant renal vessels will cross around the ureter and as a result compressing the ureter. So obviously there is junction obstruction is seen. Then acquired causes can be, there can be calliculus may be seen which can get obstructed, or due to instrumentation or due to infections, pelvic-ureteric junction obstruction is seen. Then this pelvic-ureteric junction obstruction is always associated with opposite pelvic-ureteric junction obstruction of the opposite kidney in 40% of the cases, and it is also associated with vesico-ureteric reflex, and it is also associated with vertebral Vater group of defects. Vater group of defects means these Vater group of defects include vertebral anomalies. It is associated with anorectal anomalies, tracheoesophageal fistula, and also radial and renal dysplasias. So all these are seen in pelvic-ureteric junction obstruction.
thank you and thank you for watching.